I can change my face, I can touch abilities. Just like, I'm just like you, I'm just like, I guess you're no more.
Timothy and I have been together for about 4 years. We are in our first year of marriage. You got fresh squeezed orange juice.
Beautiful.
Today I'm going to Malibu. I'm going to my mother-in-law's house. We're going to do a little Botox party for colleagues. Hello. Hi, honey. Hi. I couldn't ask for a better mother-in-law, and we're fast-growing best of friends.
When Timmy brought her home, I found out not only was she beautiful inside and out, but she was a plastic surgeon, and I said, thank you, God.
Hey, girls. Welcome to our Botox party. It'd be nice to bring a little bit of that corner up. It's a little bit more youthful. You frown like you're angry? It's really about trying to get into that belly of the muscle. Okay, put some pressure right. It stings a little.
Just think how beautiful you're going to look, Gail.
I'm going to give you a little bit of a break. Okay?
Yeah.
She's crying. Okay. When you do these Botox parties, you're able to chat with the women a lot more candidly than having them come in a really formal setting into the office. I'm all sweaty. And it allows them to be a little bit more relaxed about questions that they might not feel comfortable asking me in the office. Frown like you're angry? Yes, I am one of the Botox followers. I get it right here in between my eyebrows.
I think it looks great. I didn't have Botox today because I'm going to have plastic surgery with Julie.
I think you're going to look fabulous.
We're going to be using Carol as an example.
Yay!
I can my face.
My name is Carol, and I can't believe how old I look. As I get older, everything's dropping.
Okay, Carol. And this is Julie's office.
Julie.
Hey, how are you?
I'm good, baby.
I'm so glad you're here. Good. Finally, right?
Oh, yes, yes.
What surgeries have you had?
I did facial work when I was 50.
My mother-in-law, Carol, has already had a facelift, but now she wants a fresher look.
In the sunshine, every wrinkle shows. I don't think there's any chance in hell I'll ever look like I'm 20 again. But there are things I want changed. My husband passed away in November. We've been happily together for 30 years. It's not going to make a difference in his being gone, of course, but as he told me, please, you may have 30 more years to go. You've got to live life. This is it. I'm going to do it this time, and then you can put me in the ground.
To operate on my mother-in-law is going to cause a little bit of, actually a lot of pressure. I want to give you a natural look. Obviously, I'm not going to pull you so you look like half of those women walking around, you know. This is something that's going to be part of my life. You know, I see her quite often, so the result has to be great.
And then you get to look at your beautiful work every day.
So I better do a good job, right? Yes. Great. I'm excited.
All right, baby.
Bye. See ya. I was quite nervous the morning of surgery.
Leading up to the actual surgery, multiple calls from my sister and brother, worried, about Mom going under.
Christy is her daughter. Christy and Carol went in a lot earlier than I did because I wanted to separate myself a little bit and concentrate on being a surgeon instead of so much a daughter-in-law.
The only thing that I have any concern about, anytime anybody goes under, that's the only fear that you have.
Yeah, that's a tremendous amount of pressure.
Considering that I have these 3 kids that are extremely close, extremely tight, and their mom is like,
We're very protective of her.
how are you?
I'm good. Good. Deep breaths. But I'm fine. She commented to me that she says, you look more nervous than I am. course, anytime it becomes a family member, it's very near and dear to your heart. So you're not just in this doctor mode where you're really just going to take care of the patient, do the best you can. There's an emotional component that you have to deal with. This surgery is very exciting. It's extremely challenging, technically very difficult. Can you do me a favor? Push my glasses up a little. I think it's my glasses that are falling. That's good. That's good, yeah.
I can my face.
First I dissected it so it's free and mobile. Then we had to go into a deeper area, and that's the deep tissue, to really pull this deep tissue up, because this is what was kind of dropping. Then redrape the skin over the area, and the same thing goes for the neck. Hey, well, I just entered the deep, and so I'm basically
So you just do
underneath.
sort of a couple centimeters beyond, and then you just go into the...
Well, there is a downside to operating on family. They're always going to have questions. If there's a problem, then there's a real downside. So you just have to be really confident about your abilities to do it.
I forgot to tell you, any time during the case, if her face starts twitching, can you just tell me? Oh, sure. It means I'm just within the nerves. The greatest danger that a surgery like this poses for Carol is, one, first, nerve damage to her face, and two, it's a long case, and you just want to make sure it's safe and you stay within a normal anesthetic time for her. Send, please. I was a little nervous the whole case. Not nervous as far as skill, but just nervous because this is my mother-in-law. I don't want to go too tight on this.
No. Take some deep breaths, open your eyes.
My biggest concern is, because we went into that plane where we talked about the nerves, was how are the nerves doing? Yeah. I know I irrigated out also. Not so she's talking and rocking while I feel like a sigh of relief. How about that?
Well.
I'm right here, Carol. Tell her I'm right here. How's your pain? So my biggest concern is, because we went into that plane where we talked about the nerves, was how are the nerves doing? You just have to see their face move before you can actually relax. Hey, Carol, can you show me your teeth? A big, wide smile? Good. Blow like you're going to kiss. Perfect. Good. That was just checking some things. And her face is moving beautifully, so in a sense you can just go, you know, exhale and just finally just relax and say, okay, good.
I was so worried about both of you guys all day.
It was long. It was long. It went pretty well. And her face is moving and everything. Remember, you were asking me about that, and so.
Yeah.
Carol's going to go home with me tonight. She's going to stay in our guest room, and her daughter's also going to stay over. So we're all kind of going to be watching over her tonight.
Oh my God. Monster. I hate this damn thing around my neck. When do I get out of all of
That's
this?
what she keeps asking me. She wants to know when this stuff comes off.
Oh, a few days.
I forgot to tell you I'm claustrophobic.
She has claustrophobia, which I never knew about.
Just relax, Mom.
And we had wrapped her in this pretty much a cocoon-like dressing. And between the anesthesia wearing off and her feeling claustrophobic, she really was not comfortable with all this pressure around her face. Okay for her eyes? Great.
Let's caravan.
Okay, good. So then we'll all caravan together. We had taken different cars, and they decided Tim would drive her home. So if anything was to happen, he would be taking care of it.
Please don't put your hands under there.
But this hurt. My stitches hurt.
Don't touch it, Mom.
Right under my chin. I'm not joking.
All right, well, don't pick at it, and I'll pull over and ask her.
Jim, get off the roof.
Jules? She's asking me to, like, pull over because I think she's just feeling a little claustrophobic.
Timmy,
Stop. What?
God damn it!
Don't take it off. I'm calling my wife right now.
No. Go get the guys. They gotta...
What? Stop! Don't pull on me!
I can my face.
Timmy,
Stop.
I have Medicare.
On the way home, Carol had a panic attack.
Oh, no. Go get the guys.
I had to go out to the hospital parking lot.
Feel better?
Yeah.
I loosened up the garment a little bit and just kind of calmed her down.
Hold, Mama.
Look,
We just put her in bed, and she's finally starting to relax. Normally, Carol is so laid back. She's loving, she's sweet.
Can she lay just
I don't
tiny?
feel sturdy.
A lot of it was the post-anesthesia. It puts you off balance, and she was just, her personality just really wasn't there.
Door won't my neck open. I thought my face was swelling and that it would shut up the airways.
Yeah.
Do you need it to be cut?
No, I want it off.
Well, I'm just going to, for now, just cut this thing right here.
Oh, okay.
The bandage pretty much holds down the pressure. It helps hold the swelling down, and if we take it off, she's just going to swell. I'm going to leave this on for a little bit, and we're just going to watch you for a little bit, and then we'll reevaluate this whole thing on your neck in a second.
The surgery went good?
Yeah, the surgery was long. It went pretty good, though. I didn't know she was claustrophobic.
Stop! Don't pull on me!
I mean, I had no idea. Usually I ask beforehand, but, you know, just sort of slipped my mind because I've never just seen her do that. And so we had to take the dressing off, and we have this little elastic bandage, and she's much happier with that. How are you? Carol came in the office. It's day 3 today. She's been at my house most of the weekend, so we're able to kind of care for her through the weekend. We took the drain out. She really didn't have much draining, so I just took it out the next day.
Yeah.
This is all gonna flatten out, you know. That's the first time you've seen it, right?
Look, it really seen it, yeah.
And
everything comes down, it's just swelling.
right, exactly. Like, you know, you look very unusual right now, and it looks a little bit pulled right here. Yeah. But that's just because there's a lot of swelling in that area. We really brought her cheeks up, Joy, but she's so swollen in this area. So far, I'm pleased with Carol's results. She is pretty swollen now. Whenever you go deep like that, I do expect a lot of swelling and long-term swelling.
So the swelling will start going down today.
Really, the proof is in the pudding. I always talk about as they heal, you can see how the swelling goes down, then you can evaluate your work a little bit more with a harsher eye. How's the tightness of that? That's not so bad, is it?
No.
We'll give you some more of these little, it's called Adaptic. It's the cotton strip that's on both sides.
I just want the next 2-3 weeks to go by quick so I can see what it's going to be like.
With all the tension that we had running around the house before the surgery, I didn't want to allude to you how nervous I was about it, because I thought it would just exacerbate your own worries. So I was really scared.
I could tell. I knew you were nervous.
I think we're both lucky to have a good dynamic with our in-laws.
Yeah, yeah. We took Carol out for the first time after surgery. Just kind of introducing back into walking and a little bit of hiking. How you doing, Carol?
I'm good.
Not too steep, is it?
It's gorgeous.
I have little cheeks here and they're still swollen, but they will go in.
My mom looks amazing. I mean, she was a beautiful woman before, but Julie's work is just incredible, and I'm really proud of her.
I had thought of how youthful I was going to look, and let me tell you, it's far more than I ever dreamed that they could do. My daughter-in-law is so talented, it's amazing.
Your friend came in the office the other day. Oh. So it was my first referral from you. I am happy with Carol's result. I've had several of her friends call me about future work and her being who she is in Malibu. There's a lot of business coming this way.
I just love the spirit it brought back to my mother.
Here. Perfect.
gorgeous out there, isn't it?
Especially in light of the fact that she lost her husband last year. And I think that there was a bit of a shadow that followed her around for the last 9 months.
My husband, his desire was that I enjoy the rest of my life. And if he had lived, he would have enjoyed what he sees.
You know, with all of our busy, crazy lives, to take a minute out and just appreciate how blessed we are, it keeps it all in perspective.
It does, doesn't it? Yeah.
My face.
I'm Carla. I'm 22. I'm a student.
I'm constantly worried about people looking at my profile. It doesn't look good.
I despise the fact that I have that bump.
Joy, I'll be back here with you. Okay, thanks.
I would say like 95% of my friends have had plastic surgery. Had it not been for them, I don't really think I'd be having this surgery now.
Carla, this is Dr. Amy.
Hi, Carla. Nice to meet you.
What can I help you with today?
I have this bump that I would like to get rid of.
Okay.
And
Carla is a beautiful woman already, and her nose actually has got great structure.
like, I feel like when I take a picture, that's like the only thing you see in my nose.
Okay.
In my circle of friends, there's 13 of us. Out of 13, 11 nose jobs. They've all had something done. I just feel like, oh, when am I gonna be next?
I've been looking up. After so many months of searching, I
You did your research.
something along those lines.
When you show me a picture of this, it looks like a very extremely Caucasian nose. I don't think it's going to be this tiny, and that's an honest answer. To do too much, then you start having this operated look.
My girlfriend had a nose job, and her nephew saw her and said, "Oh my God, you look like Michael Jackson."
Yeah,
and I was like thinking, that's hilarious. Yeah, I don't want anybody to tell me that.
Right. I think what you're looking for is basically a refined nose, and I think I do a very good job. The problem with Carla is she's extremely picky about the way she wants her nose to look. And Carla's bump, it surely is not something that is very obvious. It's very soft and subtle, but to her, she really saw this as, you know, a big, huge bump on her nose. We need to make sure that her goals and what we can do as surgeons mesh.
I know that you're not God, but I would want you to just do the best.
Of course.
Whatever you have to do to make it look beautiful.
In Los Angeles, the way you appear is very important. We put a lot of emphasis on the way we look, and it's just the nature of being in the city. Today is Carla's surgery. She's going to be having the bump taken off her nose.
I'm feeling really nervous.
I've never had any kind of surgery done before.
I'm Carla's sister. My name is Bianca. I'm here to accompany my sister. She's gonna get her nose done. I love her nose, actually. There's no bump. There's nothing on there. And I got paranoid first. I asked the doctor, I'm all, Julie, do you think I need a nose job?
Carla has a very nice nose to begin with, so she wants it more refined. She has a very slight bump. You almost have to really look at her profile to see it. People that get surgery, everybody's trying to be more perfect in their minds, what they perceive perfection to be.
Ready?
Yeah.
Okay.
Bye. Oh my God, look.
I don't think I would have ever done this surgery had it been so accessible to me. It's more common, and because so many of my friends have had surgery, I figured, you know what? If they did it and they're okay, maybe it's okay if I do it.
Morning, Carla. Well, I'm just nervous just about the whole thing. I was just like thinking, like, if I would have been somewhere else, I think right now I might even still be contemplating about doing it, but
Running out
so
the
I
door.
feel safe, yeah.
Good,
That's
good.
one thing.
Well, that's what I want you
Yeah.
to do, really. I'll take really good care of you. There's a lot on your mind right now.
Yeah, I told you that bump is like the main
Of
thing.
course, yeah. When someone describes that a physical feature is holding them back, it always does make me feel bad.
I want like a very tiny ski slope.
Makes me feel bad, but also is nice to know that I can fix those imperfections so someone does develop a lot more confidence.
Okay. I think plastic surgery has become the beauty norm. And you know what? I'm not so sure that's good.
Sure.
I'm scared that for some terrible reason, my nose is not gonna look like what I want it to look like. And then I'll just feel terrible forever.
Nice deep breath. You go to sleep right away.
Her nose looks actually pretty good.
I can my face.
Carla is having what we call a rhinoplasty or nose job. She's also getting a little bit of an injectable to her lips to make them fuller. 11 blades, please. Anytime you have a refinement surgery, there's the nose that they envision and there's a realistic nose that you can perform. So we are going to incorporate what her goals are, but we're going to make sure it fits her face. Right now, we're fashioning the strut. She wants to define the tip of her nose, so we almost have to project it out. Strut is going to support that. Put that in a safe spot. You don't know how many times I've looked around and I thought I lost these things. I'm going to put that strut in between there. Did you see the bump beforehand?
No, I didn't.
I mean, it's so slight, you know? But that's what she sees. It's like, oh, the bump, the bump. And Asians, all they want is the, you know, we have flat noses. We want them higher. Yeah. Okay. I'll tell you when we're going to start hammering away. Tap, tap. Tap, tap. Breaking the bones to make her nose a lot thinner. We thinned out that. That bump is definitely gone now. We sew her up and then it's done. And then we'll just clean up her lips and we'll go ahead and inject that. She just wants a little bit of fullness to the lips. She doesn't want to be all Hollywooded out. Her tip's rotated. This is thinner here. Her bump's gone. Her lips are fuller. I think she's gonna be happy.
Well done, finish. Carla, don't move, don't move.
Okay, Carla. Okay. Just sit and relax.
Go.
Don't touch your nose. You had surgery.
You don't want this? Okay, we take it out. Okay.
Hi, how are you?
I'm okay. It's now been a month since my surgery. You know, maybe 50% of the swelling is down.
Now, I know you're going to talk to me about the swelling. When you're healing from nose surgery, you have to be patient and wait. It honestly takes up to about a year.
I just keep having nightmares, like, oh my God, if the bump comes back, I'll just die.
Oh, don't worry. It's a nightmare.
It's a beautiful day in California. The weather is so nice. I just can't wait till my swelling goes down so I can go to the beach, play volleyball, and when I get close to my friends now who have beautiful noses, we're just all gonna be looking good together in sync.
I can my face.
The way I wake up in the morning and look in the mirror every morning and see the people always comment, oh, you look like you didn't get enough sleep last night, or you're tired. And it does look that way. And I do sleep very good. Believe me, I sleep very good.
Don? Hi, I'm Dr. Edwin. Nice to finally meet you.
Same here.
Don does not strike you initially as the typical plastic surgery patient.
Down at your hut.
He does have a legitimate complaint, and he is man enough to know what he wants. How old are you?
52.
Go like this for me, like you're squinting to keep the sun out of your eyes. He's a general contractor. If you look at his skin and you look at his hands, you can see that it's been weathered by the type of work he does.
The bottom really bothers me too.
Right.
You can really see the bags.
Right.
And it makes me look tired all the time.
Right, it does.
There's a lot there.
Yeah. There's a thing called fat repositioning, where you take this fat here and you reposition it over here. See, and so you don't have this line that comes here and then down. And that's a softer look, and then it's not going to look so flat. I'm trying to look for the best option for you, and I think that would be it'd be a nice option. If we did the repositioning procedure, it might take a full week to recover, and you still be a little bit bruised underneath there.
Oh, I can wear bruised.
Okay, well, you know, I don't...
I'm not a model, I mean,
You're...
I'm a contractor. If they say, what's wrong with your eyes? They'll say, somebody hit me in the nose.
Oh, there you go.
Next Tuesday or Monday or something like that. Is there going to be a problem with me going to Vegas the following week?
Yeah. If something happens, I can't get to you in Vegas.
I'll tell my wife.
Okay. Do you smoke?
Yes, I do.
How much do you
Pack
smoke?
a day. 40 years.
Guess there's no chance of getting me to...
Tell you to quit?
Yeah.
No.
Okay.
You think that my wife's tried for 30.
Oh, okay. Yeah.
All right. Thanks a lot.
You're welcome.
2 lattes, please.
We met in kindergarten, and we've been married, what, 32 years?
33.
Did you stop smoking? You're gonna have to stop smoking pretty soon.
Get lost.
He said you have to stop smoking.
I know. What are you gonna do? I'll quit. What can I say? Expecting a little bit of surgery here on my eyes. It look like I'm tired all the time. Oh, I'm not nervous at all. No.
Hi, Don.
Hello.
How you doing?
I'm about 4 hours off of drinking coffee right now. As soon as I get out, I want a cup of coffee.
Okay, I promise you when you're done, you get your cup of coffee, okay?
I had 1 cigarette yesterday.
Okay. After the post-operative period, really try not to. You know, I can do the best I can, but that's probably your contribution to helping this heal as best as possible. Okay? The type of surgery he was getting is really going into the deeper planes, and you really need blood supply to those areas in order for it to heal. Smile for me. When someone's smoking tends to take oxygen out of blood. It could potentially have bad results. Okay, let me just check on the OR, make sure everything's getting all set up for you.
Okay. I need a cup of coffee.
Yes, it's time to go.
See you when you wake up.
Yeah, there you go.
I can my face. I'm just like you, I'm just like you.
What we're gonna do for Don is basically do what we call lower blepharoplasty, which is the lower eyes. Knife, please. We're gonna make an incision on the inside of the eye, take out the fat that's underneath his eye. I'm gonna need the orbital retractor back. We're also gonna reposition some of that fat to take care of what we call this tear trough. We've already isolated all our fat pockets. Right now, we're going down onto the bone so we can slide the fat into that area, and this is gonna address that groove that we were talking about. AMR retractor. We're done with the first side. Where I feel the most comfortable, it's absolutely in the operating room. That's when you're in your zone. It's just you and your patient and your art. This is a lot of excess fat that we're essentially gonna drape it over this way to cover the groove. Most of the case is done. Now we're just controlling a little bit of the bleeding. Thank you. There we go.
How are you feeling?
I should.
Why?
It's hard to see a loved one like that. Stitches, blood, bruises, anything. It's just hard.
We're gonna give you coffee as promised, okay? Hi, Miguel. Good. One shot.
One shot?
Alrighty. The biggest thing is he's asking for his coffee. I took away his cigarettes, so I can't take away everything. I promised.
Oh, that was nice.
See, I promise. He's all swollen. After beating him up. Did I get it right? No sugar, that's what he said. Now you can start your day, right?
Thank you if I'm not talking.
That's all right. How you feeling? The surgery we did with Dawn is something that not a lot of people are doing these days, but is the trend of the future.
Feels like I've been hit in the face with a baseball bat or ran over by a Mack truck. Surgery is surgery, you know. It's not a vacation, let's put it that way. Oh my God.
It's hard. Bruise, cut, but something you wanted to do.
This was your mother's idea. I was happy.
Hi, Dawn. Ooh, I see you got the coffee already. Good.
Hello.
How was your night?
Horrible.
What was so horrible about it?
Just pressure. Couldn't sleep.
Where are you feeling the pressure at?
Everywhere. It's very swollen, and I didn't expect it to be that swollen.
I think Dawn is going through a natural progression of emotion.
Is this normal to have that much fluid in there?
Yes, it is. Which is, why did I do this? This is not what I expected. But once he gets the bolsters off, I think everything's gonna be fine. He's gonna be a lot more positive about it. It gets better after today. So you're going through the worst right now. The tension in these bolsters can probably be very annoying. Does it hurt as you move your eyes at all when you look down or when you look up?
It's the same all over. How long is it going to stay in?
That needs to stay in for about 5 days.
Oh, my God.
Okay with that?
I guess, yeah.
Yeah. It's not until I take the bolsters off and see how he's recovering can I really be happy. I reserve that until I see the final product. How are you doing with the smoking?
Good.
Good? Meaning?
Good.
That you're doing it?
I had a puff off a cigarette.
Okay.
And one this morning.
As long as you're trying. That's all we can ask, okay? All right, Don. Looking good?
Thank you very much.
Okay.
Have you had a convertible before?
No, I never have. No? When I look in the mirror now, I see 20 years difference, yeah.
It definitely makes a difference. He doesn't look tired. He looks younger. He looks healthy.
It's beautiful.
Drivability of this car is absolutely fantastic.
Having the surgery and sitting in a newer car might look good, yeah. Thank you very much.
Can you come back next week and drive it?
Sure.
Yeah,
Good.
okay. Yeah, he looks great. It was worth it.
I can my face.
I feel fairly comfortable with my body. The one place where I'm not feeling so great is my breasts. I used to have much larger breasts, and after having 2 children, I've got 4 years of breastfeeding on them, and they've shrunk down to almost nothing. It just doesn't look womanly. They don't seem to fit my body type anymore. Hi, Christine. How are you? It's good to see you.
So, last time we had talked about a 325 as far as your size.
Yeah.
Are you still pretty much on the same page regarding that, or do you want to try a little bit more?
I want to try.
Okay, if we can go get the sizers. Christine really was having a hard time deciding what size she wants to be. We had been actually talking about this for over a month.
Go ahead and put your tight shirt on.
Women have an ideal of what they want to look like. The whole game is trying to extract that image from them and have it formulate into something that we can put our hands on.
These are enormous.
Yeah, like a small V, yeah.
What are these?
That's 300.
Yeah, I don't want to go any bigger than that.
You look at how it fits your body. You know, you do have the height too. Just try a size down just to see, for comparison's sake. The difference with breast surgery compared to the rest of surgery we do is there's an underlying emotional and sexual component to the size of breasts. And so sizers are key in coming to a vision that both of you agree on.
It's hard for me to say, looking at this one, oh, I like this one or that one better, because they're sitting differently. This one looks smaller to me when I look in the mirror.
It's not unusual that a woman goes through these gymnastics in her head regarding size, but it gets a little bit frustrating. Most women, after they have surgery, they get used to the swelling. They say, I wish I went bigger. I'd say it's probably 80% that say that.
Yeah, but I definitely don't want to go bigger.
So like a smaller one?
I think that in my head, I have an idea of where I want to end up, but I don't know if I can relay that to the doctors in such a way that that's exactly what I end up with.
So you're nervous?
I am nervous. I can't believe it's coming up so quick.
You like the doctor? Are you comfortable with her?
Yeah, she totally reassured me. I feel really good about doing this with her, and she's been super patient with me in the whole sizing thing. This hasn't been easy getting to this point.
So what made you want to do it?
I used to toy with the idea all the time of going back to the size before I had the kids.
I know what she looked like before. She had really great boobs before. So what are you most worried about?
I think I'm most worried about the going to sleep part. That part scares me. The anesthesia and how I'm gonna feel afterwards. And then of course, the end result. I have no idea what I'm gonna look like. I just hope that I end up with what I have in mind for myself.
Yeah.
I don't want to be too big. I don't want to be so small that I feel like it wasn't worth doing. Just want to sort of fill up what was
taken away.
Now's the time. Today's the day.
Yeah. It's like I have to have this over with at this point. I'm just overanalyzing everything and looking at every little detail and just sort of freaking myself out. I think as soon as they put me to sleep, I'll be fine.
Oh, well, yeah,
it'll be, yeah.
Feeling much then.
Oh, I can't wait. I can't wait for this video. Just be done with this. Last night I was really, really excited. And this morning I sort of woke up terrified. Here we go. It's scary, and I think the scariest thing is I'm so afraid of what I'm gonna look like when it's all over. It's the not knowing, it's the not being in control when they're doing all that stuff when I'm asleep.
Good morning.
Good morning.
Hi, how are you feeling today?
I'm feeling okay. Feeling ready now, yeah. I was really anxious before.
And what about size? I know you were going back and forth as far as sizes. Are we still pretty much the same size we talked about during your pre-op?
Yes, we are. I've definitely been neurotic about this and gone back and forth and back and forth.
Christine, even up to the day of surgery, she still wasn't sure, and that's a little unusual. What we're gonna do first is we're gonna do some markings.
Okay.
What I'm doing first is I'm gonna mark your midline. She's afraid of actually going in through anesthesia, and she really has a lot of deliberation about what size she should be. So there's a lot of different things working on Christine as far as what's concerning her. I'll see you back there, okay?
All right.
I'll take good care of you.
Okay.
And you got Michelle in the room. She's gonna be by your side, so.
All right.
Michelle has a medical background. I used to work at a surgical center where she was a nurse.
Thank you so much. Oh.
Christine asked me to be here with her today, and I talked to Dr. Edwin, and she agreed that that would be okay. We had worked together in the past.
I'm going for a walk.
Christine is one of those type A personalities that are very, very in control of her life. And when you have those type of people undergo surgery,
Okay.
it is a very scary place for someone like that to be.
Relax.
Christine is going to have breast augmentation surgery.
You might feel a little bit of a sting in your hand, right hand, okay? This medicine does that.
Okay.
She's a little bit emotional because it's something she's been thinking about for a long time. What is nice, though, she does have an overwhelming amount of support here.
Love you. I love you.
Just close your eyes.
Slowly.
Michelle is a very good friend of Christine's. They have known each other for a long time. So there's a comfort level that she's there, too, watching her friend get surgery. The first thing we're going to do, we're going to be putting breast implants through her belly button. So when it heals, it's pretty much going to tuck right underneath there. You're not really going to see any incisions. Okay, great. You basically insert a variety of different instruments through a plane, which is the same plane that you use when you're doing liposuction. So it's all about smaller scars.
Exactly.
And that allows you to travel over the abdomen underneath the breast and put the implant into position underneath her muscle. We can go ahead and open up her implant. So this is all ready to go. We're going to be doing this left-hand side first. The transumbilical surgery makes it a little bit more difficult because it's what we call a blind procedure, not absolutely looking at the muscles. And so now we're on the right-hand side, but I always like to offer the best procedure for the patient, and that's the best procedure for her. I know she has this big fear of going too big. That's good. So I don't think it's too big for her height. Great. I think that's good. Let me just take a look one more time. She's put in a sitting position because that's the position that people are going to be looking at their breast at. What do you think of the size?
I think the size is great.
Yeah, the size is good. This is what she had talked about. It looks good. Yeah, that's good. Okay, we can put her down. I'm just going to sew up the belly button and we're all good.
It's not big.
What's that?
Men's standard is not big.
Oh, well, you know, men's standard. She's gonna be happy.
Christine, we're gonna move you to recovery room, okay? Let's go.
Take some deep breaths, Christine. This is just an oxygen mask, okay? You need to take some deep breaths of oxygen. Just relax, you're fine. You're fine.
My kidneys hurt.
I know, you just had big boobies put in your chest, remember?
I'm gonna give you some medicine.
Oh my God, my kidneys hurt.
Oh.
Okay, there.
Oh my God, it hurts.
I can my face.
Christine, take some. I'm right
here. Fuck, I don't like this.
Just relax, you're fine.
Oh my God, it hurts.
Just give some timer to make her sleepy. Okay.
Just take some nice.
Don't move too much.
Okay.
Oh my God, I don't want to do this.
There.
All right. Okay, hold my hand, hold my hand.
Just take a nice deep
Hold
breath.
my hand, you're gonna be fine.
Oh, my knees hurt.
Christine is having an adverse reaction coming out of anesthesia because she doesn't like to be altered at all. It's not really a medical adverse reaction, it's more of a psychological thing.
Christine was a little bit emotional going into anesthesia, so coming out, it might have affected a little bit of the outcome of the way she wakes up.
I'm just really tired. I want to go to Morgan's and I just want to lay down.
What do you think of the size? Or you haven't had a chance to even look? No, okay. Eventually. Call me if you need.
I'm in a lot of pain and I'm just tired. That's all I feel. It feels like I can't take deep breaths.
Ready to go.
I'm afraid that that's gonna freak me out a little.
Oh.
I can my face. I'm just like you, I'm just like
Hi. Christine, how are you? Just go ahead and sign in.
Hello, ladies. So how was your weekend?
It was good.
So did you take a look yet?
Yes, I have.
And what do you think?
I like the left one came out really, really well. I'm a little concerned with the right one.
You're talking about this right here?
Yeah.
Yeah, that's just sitting a little higher. What I'm gonna have you do in a second is lay down and I'm gonna push on it and see how that looks. This is actually dropped into place pretty nicely. This is still pretty high. She did have one drop faster than the other, which isn't unusual, but that's something that needs to be addressed. What I'm gonna do is I'm gonna press on your breast, okay? So all I need you to do is take a couple of deep breaths, a little bit. Deep breath in and out. Deep breath in again. You can feel pressure.
Oh my God.
Sorry, sweetie. So sorry. That's all I'm gonna do. I'm not gonna touch him anymore, so don't worry. But that already kind of pushed it. It pushed it down.
It feels totally different.
I just want to do it. If I can do it one more time, that's all. You know.
Yeah. No, I prefer you to
Okay.
try to get it. Then I'm gonna feel better in the end.
Deep breath in.
She actually pushed it into place, which I thought would be horrible pain, but it wasn't as bad, so I then encouraged her to please do it again, anything to get it back into place.
So what do you think of the size? You didn't say anything yet.
Because of all the swelling and the funny shape right now, I'm still like, oh, okay, we'll see where it goes.
Hello. How are you?
Fine.
So what do you think so far?
So far, I like it. Yeah, it seems to be healing really well.
Now I know the last time we talked, you're a little bit higher on the right, so we're going to take a look at that today. I don't remember the last time I've seen a symmetrical breast. They're always different on one side or the other, so the rate of descent or drop is going to be different one side or the other. It's pretty soft. I think it is coming down just a little bit. Usually takes anywhere between 3 and 6 months, depending on the breast tissue itself. Okay? All right. All right.
It's been 15 days since I had the surgery.
It's very pretty, I like that.
I do feel sexier in some of the clothes that I wear.
Yeah, I like that one.
Yeah?
Yeah, it's
really pretty now that I have something to put in it.
I think I ended up with the look that I was going for. I feel like the bigger breasts balance out my upper body. My boyfriend's happy with the results. He's seen pictures of me from the past when I was bigger breasted. What do you think of that?
I like it. Looks great on you.
You look like you like it.
Yeah.
The first post-operative visit I had, I went in feeling like, oh my gosh, these breasts are too big. But I also had a lot of swelling, and there's been a big reduction in the swelling, and I'm much happier with the size. It's funny because those that I haven't told haven't noticed a difference, which makes me feel more confident about the size that I chose and that I didn't go too big. This one's a little bit more revealing. It's fun to go bra shopping now.
Looks great, baby.
I've had a couple people tell me, wow, you look different, you're glowing, something's different about you, and I haven't let on, though.